to reintroduce myself again for anyone who doesn't know me, I'm Dr. Lisa. I'm a GP. I'm a lifestyle doctor, an obesity doctor, and I focus mostly on men's health. That's what I'm really interested in. The men that come to see me in my clinic tend to feel that they're out of control with their health. They might be living with obesity. They might have developed some of the chronic conditions that go with that, like type 2 diabetes or high blood pressure or high cholesterol. They might be feeling stressed or anxious or depressed. Even they might be feeling like they wouldn't really care if they didn't wake up tomorrow. They're the sorts of people that I tend to see, or they just want to get to grips with their life and their health and want to make some changes. And what I do is that I love to help them turn it around. I like them to get back in control of their health, see the weight coming off, maybe reverse their conditions, reverse their diabetes, make them or sort of help them to feel more relaxed, more like their old selves again, and happy and thriving. And I do that through this men's health club, where hopefully people might be able to learn a few things and improve their health. And I do that through my one-to-one sessions as well, having a sort of men's MOT health assessment, and also through my transformational lifestyle program. So where we focus on certain health conditions, and then we try and transform them and try and change them. So just in case anyone doesn't remember or doesn't know, I've said that I'm a lifestyle doctor. What is lifestyle medicine? Well, it's a type of medicine that's based on improving the 6 pillars of lifestyle, which you can see the pictures here. They're diet, exercise, good mental health, avoiding harmful substances, getting good sleep, and maintain sort of nurturing healthy relationships. So we focus on these 6 pillars of lifestyle, and we try and use techniques which are validated to try and change behavior. And the one that we're going to focus on today is healthy relationships. So last month we talked about diet and nutrition and obesity. And this month we're talking about healthy relationships. Okay, so this one could be seen to be as a little bit fluffy. So people are a bit like, well, I'm interested in my diet and my exercise, but connection, that's just like, is there actually any evidence to show that that makes a difference? Well, I've been looking at it and studying it as a lifestyle doctor, and actually it makes a huge amount of difference. So being healthy isn't just about not having something. It's basically a complete state of feeling your physical health, your mental health, and your social health are in good order, and you've got good sort of social, physical, mental health and social well-being. It's not just the absence of disease, and that's the WHO, World Health Organization, definition of it. And actually, this social well-being is one of the most sort of powerful health interventions, and it's actually one of the most overlooked. So what do I mean by social connection? So what this means is basically it's an umbrella term, and it's basically how do you interact with people and how do you relate to other people? And the opposite of that is being socially disconnected. So if you're disconnected from people, you might be what they call socially isolated. Now, this is an objective measure. This is basically talks about how many relationships you have with other people, what your roles are, what your interactions are. It's basically an objective measure. However, the feeling of loneliness is different. That's a subjective feeling. That is, you feel lonely. Now, you could be surrounded by people, you could have loads of people in your life, but if you don't have good relationships with them, you can still feel lonely inside, and it's kind of a very painful personal feeling. It's basically between what you want in relationships versus what you've actually got. And we're talking about the sort of physical, mental, and social health. They're all very much interconnected. So why is this important? Well, actually, before we get into that, I'm going to tell you about the scale of the problem. So basically, there are 1 in 6 people worldwide affected by loneliness. It's linked with 100 deaths per hour around the world. And there are sort of 800,000 deaths that are linked to loneliness and isolation in a year. This is worldwide. In England, 1 in 4 adults feels lonely sometimes, and 6% of people feel lonely most of the time. It's actually the scale of it is actually very big. And in 2025, the World Health Organization recognized social disconnection as a global health priority. So that tells you how important it is. So what happens if you're socially isolated or lonely? Well, basically increases your risk of death, for one. It can increase your risk of other health conditions. So if you're lonely or socially isolated, you have an increased risk of cardiovascular disease, that's your heart and your blood vessels, your increased risk of having a stroke, increased risk of diabetes, depression, anxiety, dementia, as well as directly increasing the risk of these conditions. It can affect your behavior. So if you're isolated and lonely, you're more likely to have poor physical health. You're not going to be physically active. You're more likely to have a poor diet. You're more likely to smoke or drink alcohol. And these are also going to contribute to all these conditions and mortality. As well as that, there's more risk of cognitive decline. So the way you think about things and your memory, you're more likely to have dementia. It's going to affect your mobility. It's going to affect your daily function. And as well as this, it's linked to an increased risk in suicide, of abuse of the elderly, and a poor quality of life. And as well as having all these health risks, you can also imagine that this is going to a massive economic risk as well, because the cost of, if you increase risk of all these conditions, is going to cost money to look after people who are ill, and also to look after people with social care. And looking at the numbers, so people who are socially disconnected, that is like they're lonely or they're socially isolated, have got a greater likelihood, sort of 50% more increase of mortality. They're sort of around about 30% higher risk of heart disease and of stroke, and a 30% higher risk of dementia, and 30% higher risk of type 2 diabetes. So the US Surgeon General has been quoted as saying that basically this impact on mortality is linked to, is about the same as smoking 15 cigarettes a day. So it's actually significant. And how does this affect your body? So it seems a bit, how exactly does it work that if you're isolated, you can have all these risks of health conditions? We can think about it in a biological way. So if you're lonely or you're isolated, there's more likely your stress hormones are going to be raised, like cortisol. You're going to have a higher risk of sort of general inflammation in your body. Your blood pressure is going to be high. Your immunity is going to change. So you can be more at risk of infections and things like that. As well as that, your behavior will be different. So if you're socially isolated, you're less likely to be physical active. Like I said on the previous slide, you're more likely to have a poor diet. Your sleep is going to be worse. You're more likely to smoke and drink alcohol. And also from a psychological point of view, you're going to maybe have more stress, lower mood, a sense of threat, or not being able to self-regulate as well. And all of these things can lead to poor physical, mental health, and an earlier death. So this is a men's group. So we'll talk about what's specific to men. Generally, with men, their social network gets a bit thinner as they reach sort of their middle age, around 40. It could be that because men, their work takes over, their family life takes over, and all the friendships they may have built around sport or going to the pub or at work, sort of quietly fall away. So they've got more other things to do rather than socialize. around about 1 in 5 men don't have a close friend. And that's different to women. Women tend to be do more likely to have close friends. And also the other thing is that when asked, men are more likely to not admit it. So in fact, probably these numbers are much higher. And the other thing that's different to men is that they are very their relationships with their partners tends to be very protective of their health. So a man who's in a happy sort of partnership will have better health than someone who isn't. And so sometimes when they lose a partner through death or divorce or separation, then it affects them harder, and they tend to then be more sort of socially isolated. Um, the other things, there are different points of a man's life, sort of their life event. So, for example, moving into retirement might be a time when they might be at risk of losing some of their social network. Yeah. So yeah. Did I say that 1 in 6 men are often lonely, or and that is probably a gross underestimation because they're less likely to admit that. Okay. So what we might do at this point, and welcome to anyone who's just joined us, is let's just have a bit of a reflection on our life at the moment. So this is just a little sort of self questionnaire to have a look and think and reflect on what your social relationships are like. So question 1 is, how often do you feel that you lack companionship? Now the scoring is, if you hardly ever feel that you lack companionship, then you score 1. If you feel like you lack companionship some of the time, score yourself 2. And if you feel that you often feel that you lack companionship, score yourself a 3. So question 2 is, how often do you feel left out? If it's hardly ever, score 1. If it's some of the time, score 2. And if it's often, score 3. And then the third question is, how often do you feel isolated? If it's hardly ever, score 1. If it's some of the time, score 2. And if you often feel isolated, score yourself 3. So you can see that these will add up to 9. That if you if you often feel like you lack companionship, if you feel often that you feel left out or isolated, you'll end up having a score of 9. But to be honest, if any of them are you feel often, then it's time to look at your lifestyle and think about how you can improve your social connections. And the last question is, so these are all from one type of validated survey, and the other question is, how often do you feel lonely, is another question. And if the answer to that is often, then we need to look at trying to improve your social connections. Okay, so what can we do about it? So I don't know if you've heard of the blue zones. I'll just briefly explain what they are. So these are areas around the world which have been studied where there are the most number of people who live to 100. So they're sort of areas in the world where they've got the most number of centenarians, like people who live over the age of 100. And what they did was they looked at all these areas and thought, what do these areas have in common? So why in these certain areas are all these people living to a long age? Is it, is there some sort of fruit, or is there some sort of oil they're all using? Is it, what else is it? What else is it? Lack of pollution? Or anyway, they looked at all the different factors, and basically the conclusion was that it's mostly their lifestyles, and it's a combination of lots of different things. There wasn't one thing that these different areas had. And these were the sort of 9 things that they all had in common. So the fact that people move naturally. So, they climbed up hills, and they didn't go to the gym, but they would walk to the shops, or they'd walk uphill, or they'd be the Japanese sort of eats is sort of squatting down. So they're always up and down using their muscles. They have a sense of purpose. They know how to sort of wind down and relax. They wouldn't overeat. They generally had a more plant-based diet. Why, alcohol wasn't totally excluded. Um, but these three are the ones we're interested in. The feeling that these people in these zones had a sense of belonging, they had a sense of community, they had strong family connections, they put their families first, and that was sort of the children as well as the elderly. So they sort of lived in sort of big extended families, and they felt like they were surrounded by sort of the right tribe. So they're also the people they associate with have similar views on health and sort of living healthily. So this is just showing that, you know, the people who've got it right because they're living healthily until 100 valued what we're talking about today, which is social connection. Okay, so we've sort of reflected on how you might feel about your relationships and things. So what can men do specifically to improve their social connection? Well, basically is finding something that you enjoy doing. There's lots of different options out there. So sometimes people enjoy there's an organization called Men Sheds, where it's basically a club where men go along and do woodwork activities. But while they're doing that, they actually they're talking to each other. So although they're focused on the activity, they're actually communicating, talking, sharing, talking about things that might be upsetting them, and they're doing it regularly. So they're literally meeting on a regular basis, building up friendships, building up, so if they do have a problem, they'd be able to speak to people. People might walking football, or even there's an organization called Man v Fat, which is where men can go along, they get weighed, they play a game of football, then the scores are added up. So it's a weight loss club, really, where you get weighed, you get points for how much weight you've lost, and also you get points for the score of the football match. So they put them together and put it in a league. And this is an organization I've really been supportive of because I think it's actually a brilliant idea. Blokes don't want to go to Weight Watchers or Slimming World. We know that only 10% of men will go to those sorts of things. But Man v Fat is a really good organization if you're looking to lose weight and you want to do something as well. So I went to their award ceremony last year, and it was really interesting. So the blokes who had lost the most weight were receiving awards, and it was so interesting because they didn't just talk about the weight. Actually, what they talked about was how life-saving it was going to a club where they felt they belonged and that people cared about them. And some of the men who were up there were basically saying that they don't think they would have been here if it wasn't for that club, because they were, feeling suicidal. There's lots of other things you could do: park runs, clubs, classes. It's basically trying a lot of different things until you find the thing that you really like. Um, so that's one thing, doing things that you enjoy. Now, connecting shoulder to shoulder. Now, generally, men don't necessarily like doing things face to face, but if they do things side by side, that tends to be better. So, for example, like playing golf. Blokes love playing golf, something you can do and kind of chat at the same time. So it's not just sitting around a circle and having a chat. It's having an activity that you can talk while you're doing it. And then, so finding what you love and then doing it regularly, and consistency will build up friendship. So, if you do it regularly, you'll see the same people and you'll build up friendships. The other thing you could try is reconnecting with someone. So think about a friend you might have had and you've not spoken to them for a long time. Pick one, message them, check in with them, be the one that reaches out. So don't wait for somebody else to get in contact with you. You make the first step and make the call. And generally people will say yes. And while we're just on the subject, thinking about looking out for our mates and stuff, or looking out for your mates, If you're worried about someone, you think, oh, I've not heard from him for a long time. I'm really worried about that guy. I'm just not sure if he's okay. There's a mnemonic that was created by Movember, which basically is the mnemonic is ALEC. So A for ask. If you think, oh, I've not seen so and so for a while, give them a ring, see how they are. And when they talk to you, really listen to what they're saying and then encourage them. So if you're worried about someone, you're worried about a mate, encourage them to go and seek professional help. So go to your GP, go and see a nurse, go and speak to, phone the Samaritans, go to Alcoholics Anonymous. And then, when you've done that, then check in with them again and just see that they're okay. So it's really important sort of to look out for each other. And it's not just, as we said before, it's not just about having people around us. It's about having people we value and that we trust and that we can rely on. Because generally, it makes you feel happier and it's better for your health. And we have got the evidence to show that that's the case. Okay, so here again, I showed you, you probably seen this a number of times now, but this is the wheel of life, which is what I use all the time with myself and with my patients. So if you're just feeling a bit out of sorts or not great, it's just like, okay, what is this? What can I do to make myself feel better? And I generally go around this wheel of life and think, okay, can I improve my diet? Can I improve my exercise? Can I improve my mental health? Maybe I need to just take more time for myself, do some breathing meditation. Am I drinking too much? Am I smoking? Am I vaping? Am I up all night on my phone? Am I watching pornography? Am I gambling? Think about, your harmful things that are doing harm for you. And then maybe think about your sleep. You're not sleeping well. Think about what can I do to improve my sleep? And then what we're talking about today, healthy relationships. So, and all of these are interrelated. So generally, if you're feeling good in your mental health, for example, and you're quite happy, you're more likely to then reach out to other people and arrange to go out or meet for a coffee or whatever. If you're exercising, you might then be doing that with other people. So you can see how each of these pillars have a knock-on effect with each other. So by improving one of them, it can impact the others. Okay. So that's basically what we've talked about for social, social connection. Hopefully I've told you what it means, what impact it can have on your health, and the sorts of things that you could try and do to improve it. So have a little think about, we did a little self-survey before about where we think we are with our social connection. If you think you can improve on it, have a think, is there one thing you can do this month to improve your social connection? Is there one person you can reach out to that you might have lost touch with, or someone you see but you haven't ever sort of said hello to, and see if there's something that you might be able to do together?